Welcome to the 3M training program for the proper donning and fit testing of the 3M healthcare particulate respirators and surgical masks. In addition to being cleared by the Food and Drug Administration, or FDA, as surgical masks, these devices are also approved as N95 particulate respirators by the National Institute of Occupational Safety and Health, or NIOSH. In the United States, the Occupational Health and Safety Administration, or OSHA, establishes and enforces regulations and standards to help protect employees by preventing or controlling occupational health and safety hazards, including the use of respirators in the workplace. The OSHA respirator standard requires that a written respiratory protection program that addresses employee training, medical evaluation, and respirator fit testing be implemented when respirators are required to be used in the workplace. Choosing appropriate respiratory protection is one important aspect of reducing the wearer's exposure to airborne biological particles. An effective respirator program, including fit testing and user seal checks, is required to ensure optimal respirator performance. When fit tested and worn properly, the respirator is designed to help reduce potential exposure to airborne particulates, including airborne pathogens, but does not eliminate the risk of exposure, infection, illness, or death. This program reviews certain elements of proper usage for the 3M healthcare particulate respirators and surgical masks, including donning, conducting a user seal check, and fit testing instructions. The fit tester should read and understand the instructions provided in the fit test kit. They should also be familiar with the donning and user seal check procedures for the respirator models they are fit testing. A fit test is conducted to establish that a particular model and size of respirator provides an adequate face seal on the wearer. A user seal check, on the other hand, is conducted by the wearer to determine whether the respirator is properly seated to the face. The wearer should perform a seal check every time he or she dons a respirator. There are important differences between a respirator and other healthcare masks. Despite filtration properties of some surgical or procedural masks, these masks cannot be designated as respirators. Respirators need to be fit tested and must meet stringent filtration criteria determined by NIOSH, a federal agency and a branch of the Department of Health and Human Services, Centers for Disease Control and Prevention, commonly referred to as the CDC. NIOSH tests and certifies respirators, carries out in-depth research on safety and health issues, and recommends standards for adoption by OSHA. Look for N95, NIOSH, and the respirator manufacturer printed on the respirator, along with N95 certification label printed on the packaging. Your facility has selected one of these NIOSH-approved 3M N95 particulate respirators in compliance with OSHA standards and CDC recommendations. OSHA prohibits use of respirators when conditions exist that compromise the fit, such as facial hair or any object that prevents contact of the respirator with the skin. See your supervisor with any questions. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program. The 3M 1870 is a 3-panel flat-fold particulate respirator and surgical mask. Follow these instructions each time you don your respirator in order to achieve a proper fit. Remove the respirator from its packaging and hold it with straps facing upward. Place the bottom strap under the chin panel next to the warning statement. Fully open the top and bottom panels, bending the nose piece around your thumb at the center of the foam. The strap should separate when the panels are open. Make certain the bottom panel is unfolded and completely open. Place the respirator on your face so that the foam rests on your nose and the bottom panel sits securely under your chin. Pull the top strap over your head and position it high on the back of the head above your ears. While holding the respirator firmly on your face, pull the bottom strap over your head and position it around the neck and below your ears. Make sure the straps are not twisted for increased comfort. Adjust for a comfortable fit by pulling the top panel toward the bridge of your nose and positioning the bottom panel under your chin. Place fingertips from both hands at the top of your nose and mold the nose piece around your nose to achieve a secure seal. Push inward while moving your fingers down the side of the nose piece. Note: always use 2 hands while molding the nose piece. Pinching the nose piece with one hand may result in improper fit and less effective respirator performance. Perform the user seal check each time you don a respirator. To conduct a user seal check, place one or both hands completely over the middle panel, cupping hands over the respirator and covering it as much as possible. Pay careful attention not to disturb the position of the respirator. Inhale and exhale sharply. Be careful not to disturb the position of the respirator. It is important to have a good face to respirator seal. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head and repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured of a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1870 Wear It Right poster to ensure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or a representative from your infection control or employee health and safety departments. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the facepiece. Slowly lift the bottom strap from around your neck up and over your head, while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body. And perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user instructions, including the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly. You wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program. 3M 1860 is a cone-shaped particulate respirator and surgical mask. The 1860S is a smaller version of the 1860. Follow these instructions each time you don your respirator in order to achieve a proper fit. Begin by cupping the respirator in your hand, holding the metal nose piece at your fingertips. The straps should hang freely below your hand. Place the respirator under your chin with the nose piece up. While holding the respirator in place, pull the top strap over your head with the opposite hand and position it high on the back of your head above your ears. While still holding the respirator firmly on your face, pull the bottom strap over your head and position it around your neck below your ears. Make sure the straps are not twisted for increased comfort. Place the fingertips of both hands at the top of the metal nose strip and mold the nose piece to the shape of your nose using both hands. Push inward while moving your fingertips down both sides of the nose piece. Always use two hands when molding the nose piece. Pinching with one hand may result in improper fit and less effective respirator performance. Perform the following user seal check each time the respirator is put on. Cup both hands over the respirator, covering it as much as possible and being careful not to disturb the position of the respirator. Inhale and exhale sharply. If air leaks around the nose, readjust the nose piece for a more secure seal and repeat the user seal check. If air leaks around the respirator edges, adjust the position on the face and the straps along the sides of the head. Repeat the user seal check. Do not enter a respiratory isolation or other hazardous area where respirators are required until you are assured you have a proper fit. If you have difficulty achieving a fit, review the respirator user instructions located inside the packaging or refer to the instructions on the 3M 1860 Wear It Right poster to be sure that you are following the correct procedure. If you are still unable to achieve a fit, see your supervisor or representative from your infection control, employee health, or safety department. Do not enter a hazardous or infectious area. To properly remove the respirator, do not touch the face piece. Slowly lift the bottom strap from around your neck up and over your head while keeping the respirator seated against your face. Lift off the top strap. Carefully remove the respirator without allowing the outside of the respirator to come in contact with your body, and perform hand hygiene. 3M recommends you practice this removal procedure until you are proficient and comfortable with the procedure and before actual use of the respirator for the first time. Leave the hazardous area immediately and replace the respirator if it is damaged, difficult to breathe through, or contaminated with blood or body fluids. Follow your facility's infection control policies and procedures for guidance on how frequently you should replace your respirator. Follow the proper fitting procedures each time you wear the respirator. When in doubt, review the user seal check instructions. If a proper fit cannot be achieved, do not enter the area requiring respiratory protection. Follow up with your supervisor. Keep in mind that when you are wearing a respirator, it helps reduce potential exposures if the respirator fits you properly, you wear it during all times of exposure, and use of the respirator is under an effective respiratory protection program as required by OSHA 29 CFR 1910.134. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program. This program will provide instructions on how to perform qualitative fit testing for half-face filtering facepiece respirators, such as 3M Healthcare Particulate respirators and surgical masks. Please note, the qualitative fit testing instructions for the 3M 1870 respirator and surgical masks are the same for other 3M particulate respirators. There are two types of fit test solutions for qualitative fit testing available from 3M. A sweet solution as found in the 3M FT10 Fit Test Kit, and a bitter solution as found in the 3M FT30 Fit Test Kit. Either of these solutions can be used. However, certain employees may be more sensitive to one solution over the other. During this training, we will be using the sweet solution. The procedure is the same for the bitter solution. Both the 3M FT10 Sweet and FT30 Bitter qualitative fit test apparatus meet the performance criteria for fit testing respirators under the current OSHA standard for respiratory protection, 29 CFR 1910.134. If crystals are present within the container of test solution, hold closed bottle under a warm stream of water or shake vigorously to dissolve the material. If there is evidence of solution contamination, immediately discard the bottle. OSHA requires that a medical evaluation be conducted prior to fit testing. A fit test should only be conducted if there is no hair growth, apparel, jewelry, or any other condition or object that may compromise the fit or prevent contact of the respirator with the skin. Subjects should be informed of the ingredients of the fit test solution and that they will be exposed to a fine mist. To prepare the qualitative fit test apparatus, attach the hood to the collar by placing the drawstring between the flanges on the collar. Tighten the drawstrings and tie it with a square knot or bow. Pour approximately 1 teaspoonful or 5 milliliters of the sensitivity solution into the nebulizer labeled Sensitivity Test Solution. Pour the same amount of fit test solution into the second nebulizer labeled Fit Test Solution. Immediately recap the bottles. A sensitivity test is conducted before the fit test to determine if the healthcare worker being tested can detect the test aerosol at very low levels. The sensitivity test solution is a very dilute version of the fit test solution. The subject must avoid eating, smoking, drinking, or chewing gum for at least 15 minutes before the test and during the test at all times. This does not include water. To conduct the sensitivity test, instruct the test subject to place the hood and collar assembly over their head without a respirator. Position the hood assembly forward so there is about 6 inches or 15 centimeters between the subject's face and the hood window. Instruct the test subject to breathe normally through their mouth with their tongue slightly extended. Both plugs on the nebulizer must be removed during use. The nebulizer must be held in an upright position to ensure aerosol generation. Using the first nebulizer with the sensitivity solution, inject the aerosol into the hood through the aperture in the hood window. Squeeze 10 times, always fully collapsing the nebulizer bulb on each squeeze. Allow the bulb to extend fully between squeezes. Ask the test subject if they can taste the sweet taste of the solution. If the test subject can taste the solution during the 10 squeezes, note the number of squeezes as 10 and proceed to the fit test. If the test subject cannot taste the solution during the 10 squeezes, inject an additional 10 squeezes of the aerosol into the hood and see if the test subject can taste the solution at this time. Repeat with 10 additional squeezes up to a total of 30 if necessary. Note whether the test subject can taste the solution after 20 or 30 squeezes. If the test subject is unable to taste the solution after 30 squeezes, end the test. Another fit test method must be used for this test subject, such as use of the FT32 bitter solution or a quantitative fit test method. Remove the test hood from the subject. Give the subject a few minutes to clear the taste from their mouth. The test subject may help clear the taste of the test solution by rinsing their mouth with water. You are now ready to conduct the fit test. According to OSHA, the respirator to be tested shall be worn for at least 5 minutes before the start of the fit test. This allows time for the wearer to ensure they can wear the respirator comfortably. Have the subject don and perform the user seal check as instructed in the fitting procedures for the specific respirator. We are using the 3M 1870 Healthcare Particulate Respirator type N95 for demonstration purposes. Instruct the subject to place and position the test hood as before. Then have them breathe normally through their mouth with their tongue slightly extended. Instruct the subject to raise a hand or otherwise notify the instructor if the sweet taste of the test solution is detected at any time. Using the second nebulizer labeled Fit Test Solution, inject the Fit Test aerosol using the same number of squeezes used in the sensitivity test, 10, 20, or 30. To maintain an adequate concentration of aerosol during this test, inject 1/2 the number of squeezes used in the previous test every 30 seconds thereafter. For instance, if the subject could taste the sensitivity solution within 10 squeezes, you would then administer 10 squeezes of the Fit Test solution initially and then follow up with an additional 5 squeezes every 30 seconds for the remainder of the fit test. Conversely, if it took 30 squeezes of the nebulizer for the test subject to taste the sweet solution during the sensitivity test, then you would administer 30 squeezes of the Fit Test solution to start the fit test and then follow up with an additional 15 squeezes of the nebulizer every 30 seconds for the remainder of the fit test. After the initial aerosol is injected, ask the subject to conduct a series of exercises for 60 seconds each. Remember to inject 1/2 the number of original squeezes every 30 seconds through the fit test exercises. First, in a normal standing position without talking, the subject shall breathe through their mouth normally for 60 seconds. Second, in a normal standing position, the subject shall breathe slowly and deeply through their mouth, taking caution so as not to hyperventilate. Continue this for 60 seconds. Third, standing in place and breathing through their mouth, the subject shall slowly turn their head from side to side between the extreme positions on each side, pausing momentarily to inhale at each side. Repeat for 60 seconds. Fourth, standing in place and breathing through their mouth, the subject shall slowly nod their head up and down with about 1 nod per second for 60 seconds. Instruct the subject to inhale in the up position when they are looking toward the ceiling. Fifth, the subject shall talk out loud slowly and loud enough so as to be heard clearly by the test conductor for 60 seconds. A reading called the Rainbow Passage is included in the print instructions for the 3M Qualitative Fit Test. Sixth, have the subject bend over at the waist as if he or she were to touch their toes for 60 seconds. Jogging in place may be substituted for this exercise. Conclude by asking the subject to breathe through their mouth normally again for 60 seconds. If the fit test is completed without the subject detecting the sweet taste of the test solution, an adequate face seal has been demonstrated with the model of respirator. If the subject detects a sweet taste at any time during the fit test, an inadequate fit is indicated. Terminate the testing when this happens. Wait at least 15 minutes if you plan to retest. Rinsing the mouth with water can help remove any lingering sweet taste. Ask the subject to review the donning instructions. Repeat the fit test after redonning and readjusting the respirator. A second failure may indicate that a different size or model respirator is needed for that employee, such as another model of a 3M Healthcare Particulate Respirator and surgical mask. The fit test must be completed successfully before a healthcare worker can be allowed to wear a specific model respirator. One commonly used strategy is to fit test all employees on a single respirator model. Those who cannot achieve an adequate fit are then provided another model. For example, you may choose to fit test all employees on a 3M 1870 respirator, Those who cannot achieve an adequate fit after several tries are then provided a 3M 1860 respirator or a 3M 1860S respirator for employees with smaller faces. The fit test procedure is then repeated. Although not illustrated during this training, according to the U.S. OSHA Respiratory Protection Standard, fit testing must be performed while the test subject is wearing any applicable safety equipment that may be worn during actual respirator use which could interfere with respirator fit, such as hair bonnets and eyewear. After completing the qualitative fit test, the unused solutions in the nebulizers should be discarded. Immediately rinse the nebulizers with warm water to prevent clogging. After allowing the nebulizers to dry, store them in a clean and dry place. There are many other types of respirators available on the market, including powered air purifying respirators or PAPRs. PAPRs equipped with a loose-fitting facepiece or hood may be an alternative for a bearded healthcare worker or those who otherwise are unable to pass a fit test on another type of respirator because PAPRs do not need to be fit tested. PAPRs use a motor and a blower to force air through air-purifying elements into a loose-fitting facepiece or hood that generally covers the entire face and head. A battery and cartridge are often housed in a separate unit which is mounted at the waist of the user. PAPRs must be used in connection with the same OSHA respiratory protection standard that covers use of all respiratory protection equipment in the workplace, OSHA 29 CFR 1910.134. As required by OSHA, respiratory protection programs must include procedures for cleaning, disinfecting, inspecting, storing, and maintaining equipment. However, as noted previously, PAPRs with loose-fitting facepieces, hoods, or helmets do not need to be fit tested. Refer to the OSHA website at www.osha.gov for the most current information about use of respirators. Contact your 3M sales representative or call the 3M Healthcare Customer Helpline for information on personal protective equipment, including the respirators described in this training, and to learn more about the other elements of a respiratory protection program.